Dr. Shlasko, what is a hernia?
A hernia is any time there's an unnatural hole in a layer of muscle anywhere in your body. Now, there are some kinds of hernias that occur commonly in children. You may have heard of an umbilical hernia. That's a hernia, an opening in the umbilicus, the belly button. You may have heard of an inguinal hernia. That's a hernia in the groin that can occur in boys or girls. It's more common in boys, and it's a hernia that's slightly more dangerous. We actually have to fix inguinal hernias. Umbilical hernias don't need to be repaired. The vast majority of umbilical hernias will close by themselves by the time the kid is 4 or 5 years old. So what we do is, if a parent comes to us with a child with an umbilical hernia, we look at it. If it's not very, very large, or if there's no breakdown of the skin over the umbilical hernia, if the baby is not having any pain or discomfort from the umbilical hernia, we'll tell them to go home and just watch it. They say that 80% close by age 5, and another 10% or so close over the subsequent 5 years. So we usually refuse to close umbilical hernias until the kids are 4 or 5 years old. If it's still quite large then, if they're still symptomatic, then sometimes we'll go ahead and do the surgery. Surgery for an umbilical hernia is actually quite simple, because all we're doing is making a little incision just below the hernia itself, going to the muscle layer where there's an opening, and sewing the opening closed so that nothing can come through. But umbilical hernias are generally not very dangerous, and because we know that the vast majority close, in general we don't fix them in little babies. Inguinal hernias are different. I'm going to draw a picture of what happens in an inguinal hernia. An inguinal hernia is a hernia that occurs in the groin. So if you imagine a little baby, and I'm going to use a boy as an example. If you imagine a baby boy developing inside his mother, the testes start out in development, I'll turn this so you can see, start out in development just below the kidneys on each side. The testes, as the baby is growing, still inside his mom, what happens is the testes move down in the belly, they come around to the front, and they come down into the scrotum. So the testes come down, around to the front, and down into the scrotum. One of the things that pediatricians do the first time they meet a new baby in the nursery is they feel to see if the testes have come down, to see if the testes have descended properly. Sometimes the testis stops somewhere along the way. That's called an undescended testis. That's a problem that I can talk to you about some other time, but it's one of the first things that is examined for in a baby boy. Well, if you think about it, to get from inside in the back to what's essentially outside of the belly in the front, the testis has to go through different layers of muscle and tissue. What happens is, as it goes through, it actually pulls that tissue along behind it, and it makes a little hole, and it pulls a little pocket of tissue down behind it. So there's a little opening that's connected to the inside of the belly. That opening and that pocket is called the processus. Now, if there's normal development, what's supposed to happen is you're supposed to have the testis descend, a processus forms on each side, and then before the baby is born, the processus is supposed to close up. So a normal baby has a testis in his scrotum and no connection to the inside of his belly. Unfortunately, in premature babies, and even relatively frequently in full-term babies, that doesn't happen properly. What happens is the opening to the inside, the processus, doesn't close. Now, if the processus doesn't close completely, but closes partly, and I'll draw it separately over here, but there's a small opening to the inside, and then a pocket of tissue that comes down below, what happens is that liquid from inside your belly, and there's always a small amount of liquid inside your belly, can come through the opening, and it can collect in the processus, and it blows up almost like a water balloon. When that happens, it's called a hydrocele. So a baby boy who's born with a hydrocele, sometimes called water on the testis, actually has a little opening in the processus which allows liquid from the belly to come down.
Do all hydroceles lead to hernias?
The answer is no. Sometimes the hydrocele opening is so small that it closes by itself even after the baby is born. So if we see a baby who's born who has a hydrocele, what we do is we wait until they're about 1 year old. At age 1, if the hydrocele is still there, we would operate to fix it. If it's gone away by itself, if the fluid has been absorbed and it's not swelling up, if it's not swelling up from time to time, and swelling up from time to time, we just leave it alone. Now the other possibility is that the opening isn't so small, that it stays quite large. So you have an open processus, a pocket of tissue and an opening to the inside of the belly. And in that situation, what happens is your internal organs, mostly intestine in boys, in little girls, when they have a hernia, it's almost always the ovary, can slip into the hernia sac. So if you imagine the intestine is a tube within the belly, and if a loop of the intestine slips into an opening in the processus, into the hernia sac, what happens is that loop of intestine causes the hernia to swell up. Now hernias are different from hydroceles because you actually have a loop of intestine inside the hernia sac, and there's a danger that the loop of intestine will get stuck. If it gets stuck, that's called an incarcerated hernia. If you have a loop of intestine stuck inside a hernia sac, it's called an incarcerated hernia. Now the danger there is that the blood supply, either to the testis itself or the blood supply to the intestine, can be kinked by the intestine stuck in the processus vaginalis, in the hernia sac. And either the testis can be damaged or die, or a loop of intestine can be damaged and die. So when we have a baby who has what we know to be an inguinal hernia rather than a hydrocele, we would schedule surgery to fix it, hoping to repair it before it incarcerates, before the intestine gets stuck.
If a child has an inguinal hernia on one side, what are the chances of having it on the other side?
The answer is that it depends at what age the baby first presents with an inguinal hernia. If you have a premature baby who in the nursery has an inguinal hernia on one side, it's virtually 100% certain that there's a hernia on the second side, even if you don't see it. So when we operate on premature babies with hernias, we almost always operate on both sides. If you have a full-term baby, that risk may be down to 96, 97%. And as you get older and older, the chance that there's a hernia on the asymptomatic side, in other words, baby presents with a hernia on one side, but nothing on the other that you can see or feel, the chance that there's a hernia on the side where you see nothing drops. So if a baby has not had a hernia that anybody has seen, mother changing diapers, father changing diapers, pediatrician, and the baby gets to age 1 and a hernia appears, the risk that there's a hernia on the asymptomatic side is about 60%. At age 2,